All right, everybody. Hello again. It's Keisha the Chemo Coach. I'm coming at you. Today is, I believe, it's actually September the 10th, but it's nighttime still, so we're not going to cross over that day yet. We're going to say it's September the 9th, I believe. Basically, it's Saturday. Uh, as you know, when you take medications, sometimes you get thrown around on your days, you get thrown around on your memory. That's kind of what I want to talk about tonight, too. I want to talk about pain. And I want to talk about medication. It's for selfish reasons, of course, because today I'm having a hard time, and tonight that's what kind of got me on the line with you guys a little late. I've been having a lot of pain issues, and just throughout the day as well. I want to say that every day when you take chemo and you take radiation and you take the medications that you take, you tend to become forgetful. You either have short-term memory loss or long-term memory loss. It depends on the individual, I guess. And I've been realizing that I have short-term memory loss. Sometimes I don't remember things that happen. People sometimes could tell me places we went, and I don't have it. It could be just the blur of it all because you have so much going on, and it doesn't matter if you're not in active treatment, meaning like in the hospital getting infusions versus coming home and taking pills. It's all still a form of chemo, and so it's all still a form of something that's going in your body, eating away at one thing. But of course, when they eat at one thing, it's not going to just eat at that one thing. Your body don't work like that. It's not targeted like that. Medicines aren't targeted that way. Radiation, even though they put those little tattoos on your body to try to target certain places, it just isn't as specific as it would want to be, because medicine and becoming an attorney are the only two professions where they actually tell you that we are practicing something. We're practicing law. We're practicing medicine. So when it comes to medications, when it comes to the pain, when it comes to all of that, it's all pretty much just a crapshoot, which, you may be able to just see it in my face tonight, the tiredness, the annoyed, ness of the pain. It all becomes very draining, for a cancer fighter of any kind. It doesn't have to be, like I told you guys before, we're not going to just deal in breast cancer, or in my case being metastatic. That is my area of expertise, but cancer itself is my area of expertise, because pink is popular, and I get that. Everybody come together and they do the walks, and so the breast cancer is very popular to pink. But first, let me say that I'm not pink. I'm pink and teal because I'm metastatic, and like I explained to you yesterday, that means it traveled from the breast to somewhere else, late stage. And a lot of research don't go to that, because honestly, I believe, and a lot of the other metavivers that I know believe, that doctors didn't expect us to live as long as we did. So they really didn't put a lot of work into us. They're beginning to now. Now you see a commercial here and there for a drug called Ibrance, and it tells you I'm a metastatic, and I'm getting used to the new normal, and life is. No, you got to still remember that even in that commercial, they showed you the best case scenario. You know what I'm saying? A woman that in the commercial, because I paid attention to it well, a woman that had her breast still, she's out walking her dog and things of that sort. A lot of people that's fighting, that's not their normal. Their bones hurt constantly, because a lot of us have to get what they call a Neulasta or a Neupogen shot, which is a shot that they give you to keep your white cells up. Your white cells got to be up because your immune system goes down. And if your immune system goes down, just your house being messy can infect you. Any messes, any, germs, any just going out. Like now I got like this thing going on with my nostril where it's stopped up. But the weather's changing, but I just feel it a lot sooner than a lot of other people. The pain, right now as I speak to you, I'm dealing with the pain. A lot of people don't understand, but You can't, when you're a fighter or fighting or surviving, or, I would guess even those that are in remission, you really can't hold obligations. Like, say someone says, I have a party Saturday, and they tell you this on Tuesday. You say, yeah, I'm coming, because maybe at that moment you feel good, and you be feel like, I'm gonna feel good, I'm taking my medicines, I'll be fine. But you can't really hold on to obligations either. Sometimes make it so you can't hold on to friendships very well, because the pain just comes. And if it come, and we call it, in the fighting world, a pain crisis, and that's any fighting. That's lupus fighting, that's sickle cell fighting, that's any fighting, we call it a pain crisis. And when it comes, it's nothing you can do. So it may come, before you were supposed to go to that party right on Saturday, an hour before, you know what I'm saying? And you just can't make it. The pain shows up in different areas, everybody. My pain is in the breast area or the chest area for me, in the chest cavity where my scars are. I told you last night that one of these days I'm going to go ahead and I'm going to show you my scars, but we're just getting to know each other. So we're going to take that slow, all right, you guys? So as time go on, I promise you, because I've taken, photo shoots. I've done photo shoots, showing my chest, but I'll be honest enough to tell you that I'm still very insecure about, the way that I look as a woman now, with no breasts, no chest. Some women have double mastectomies and they get new breasts, and they may not have nipples, but they actually have the actual breast. Some of us are in a different category where, we've had so many surgeries that we just don't even try to get that elective surgery, what I'm saying? And two, our skin don't stretch enough to be able to do it. And, maybe at the time we couldn't get the expanders put in. That's expanders or something that they put in you right after you have a double mastectomy. It's like these little sticks to slowly stretch your skin out. So like every 2 months or month or so, they put a new expander in and stretch your skin a little bit further, and you keep it in day and night. And every so often you go into the doctor and they check how your skin is stretching, and then they put another one in. They take those out, put another one in to stretch you a little further. But some of us are in, when we get our double mastectomies done, we're in such a pain crisis, and we're in such a crisis, we're fighting for our life, that we can't do it at that time. And that's the position I was in. So I say that to be honest with you, because I was just watching a commercial on Viceland, and whereas I'm glad we get attention, I really wish that they would show the real, a real woman that's really fighting what cancer really look like when you have a double mastectomy. Because they showed a woman, and she was getting in a lake, and she had a breast. Her breasts looked like they were maybe a size, excuse Damon, but they had breasts like he was coughing. So excuse him if you heard him. But they had she had breasts that was maybe like a size D or a C cup, what I'm saying, and it looks really normal. But she didn't have nipples, because a lot of times, the nipples don't attach well, so they end up decaying and coming off and, dying off basically. But bottom line of it is, she had breasts, and you couldn't see her scars all that well from it, even though the TV may have did some editing or whatever. But when I looked at it, I can't tell you no lie, I was happy to see that we're being, recognized, but I got a little annoyed, because I was like, that still isn't a true reflection of what we look like and what we go through. Just like with the Ibrance commercial, it's not really a true reflection of what a metaviver is and what we go through. We're in pain constantly. My chest right now, I feel like I have, that's the best way I can explain it is, I feel like I have a big, I feel like I have a door attached to my chest, and they've nailed it in. That's the way I feel. My head is constantly banging. My head is constantly hurting. My bones, they feel like inflamed in my legs and my arms, because in my arms I also have lymphedema that happens when you get some of your lymph nodes removed. The flow of the fluid, I guess, it can't flow as well, so it gets built up into your arm. So my left arm gets this build up that hurts. But beyond that, your bones just feel like what I guess maybe a 75, 80-year old woman would feel. I don't know. They feel brittle or they hurt. And you just feel pain walking. Your fingers and your toes have what you call neuropathy. But that's from the chemo or the radiation or a combination of the both. I don't know. And what that means is like when you're in active chemo in the hospital, infusions, they give you chemos that make your nail beds hurt, because of course with any sickness, the best way to tell that you're sick, your nails will tell you first. Your hair, your nails, and maybe the color of your eyes and your toes, because when anything attacks your body, it attacks the easiest things to attack first, and that's always your nails, your hair, maybe the color of your eyes, like with jaundice, and your toenails, because they're the easiest to attack. Attack that first to kind of that's the magnificent thing about God, I guess. He made it so what I'm saying, your body is so magnificently built that you will get warning signs. It won't just completely attack your basic organs that you need first. An illness that slowly attacks you normally, or even the medications when they attack you, because they're there to help, but they attack you, it attack other things. So you never have feeling in your nails or your in your hands, rather, your fingers the same, or your feet the same. My feet is always numb and feel like there's no blood in them. I still vomit every night. It's not an easy journey, what I'm saying, to go through, is what I say. And I speak all of this because, yeah, I'm going through it, but I know it's lots of other ladies that's going through it. You attach that to, having that pain all the time. That pain works against your mental stability, and it brings on, depression. It brings on PSTD. You don't have to be, PTSD, I'm sorry. You don't have to be a war soldier to get, post-traumatic. When you're a cancer fighter, or even when you're a survivor, when they giving you the all clear, when they tell you, you're all clear, you're always worried that it's going to come back, because the chances have increased for you just by the main thing, just because you've had it before. Now, in cases like people like me being a metaviver, where it's not going anywhere, meaning like you're going to be fighting, and then you attach the fact that I'm genetically connected. I carry the BRCA1 gene. You're completely post-traumatic. You're completely stressed at all times, because you don't know what that little feeling that you're feeling is. Like sometimes I feel just basic little bumps. I don't care. It could be a mosquito bite. That's how paranoid I am. And I can feel it, and I can think that, oh my God, it's a lump coming again. Oh my God, and you go into stress mode. I'm not the only one. I know it, because I've learned that if I feel a certain way, and that's the reason why I do these video diaries now, because I do be in my inbox, and and I do talk through the DM and all of that, but it's nothing like actual conversation. You know what I'm saying? Typing tells you whatever, but it's nothing like actual conversation. So it's, I feel like, talking to you guys will get you to understand. And a lot of you guys are going to sit there and you're going to be shaking your head like, yep, I know, me too. Absolutely. I didn't know how to say that way. I didn't really know how to, express this pain and this feeling of, fear that's in me. I didn't quite understand, and I thought that maybe I was the only one that was walking around afraid every day, all day. No, we all are. Even people that got the all clear. You know what I'm saying? A lot of people are spiritually connected to their God, or, some people are spiritually connected to their pastors and their churches and their congregations or whatever. So, how, a lot of us do, and especially, African American women, we go to a church and we pass it over to our pastor and we feel like he gonna pass it over to God for us. And so we allow them to, give us the fight and give us, do it for us, so to say. Like I told you guys before, I'm not a very religious person at all. I am, spiritual. I have my own connection, but I don't go to see a pastor, saying, on a regular. And, I have my own issues with that, so, I basically, I read books, I educate myself, I try to become, knowledgeable in it just to understand what I'm going through. Every book I read is not a book on cancer or a book on chronic illness. Some books I read, sometimes I'm reading The Art of War again. Right now I'm reading The Art of War again, because I'm just trying to gain mental strength in the places where mentally I know it's becoming a little diminished. That's something I offer all of us fighters too, in order to keep your mental stability going and to keep your, mental strength going, and, to exercise your brain. They got those little games on the internet where word games and word hunt and find these pieces and find this and find that. Play those games, because I believe that those mentally help you. You know what I'm saying? They help exercise your brain, because taking all these medicines dumb you down. And I know this. It dumbs us down. And it's a trip to take all these medicines and still feel some pain. I get some relief instantly. That's why I'm able to talk to you right now, because I took my pain medication, let it sit for a while. So now I feel like, okay, Keisha, you can get up and talk now. You know what I'm saying? Go ahead, get up and talk now. You can do it. But you feel crazy that you got to get up and take a medication just to even feel good enough to put a phone in front of you and talk to people or talk. That's depressing within itself. It's as a lot of warriors say that I know, you got to get used to the new normal, the new normal, the new normal. The new normal sucks, but I'm treading through it, and in the process of treading through it, I want to teach you how to tread through it as well, fighters, especially my younger fighters, because I also have lost so many fighters because they gave up. I don't feel any way about them giving up, because I understand, what I'm saying, that the pain becomes so much, and these hospitals and doctors, and I go to one of the best, I believe, but honestly, they treat you like a guinea pig. They just want to see what a medication will do for you, so that way they can give it out to the masses, so they try them out on you. You know what I'm saying? I've been a guinea pig so many times, which I don't mind on some levels, because if it'll help the next, set of people, then go ahead. Like, they bring all those student doctors in the room, and they let a student doctor go on your port. If you don't know what a port is, this is a port. Like, I'll show you real quick. That's a port. That's where they put all my medications and they do the infusions through, because you can't use my arms any longer. So, that's a port. So it helps me in one way, where they don't have to fiddle for veins and look for veins in my neck or in my head or in my foot, which, or anything like that. But do you see the way it bulge out my chest? That crap hurts. You know what I'm saying? I'm just being honest with you. That crap hurts. But back to, the medication and the fighters and the fear and a lot of people not continuing to fight, and giving up. I have so many loved ones, because like I told you guys before, I'm genetic to it. So, a lot of my family members have fought, and a lot of them have given up at a certain point in life. You know what I'm saying? And giving up to me doesn't mean they say, I give up, so I'm just going to, accept the fact that I'm going to die. Sometimes it means doing negative things like that they know will work against them, like drinking, like doing drugs of some sort besides marijuana for those that do the cannabis, because I have nothing against that at all. But they do other drugs, what I'm saying, or they just stop going to chemo, because the chemo is hard. It's funny, I didn't start feeling pain when I got diagnosed, what I'm saying, until I got on medication, until I started the chemotherapy. That's when I started feeling pain. It's just difficult for a lot of us, and sometimes we get to a place where we just say we tired of fighting. I've been at that place before, but like I also told you guys, I got these kids, and my youngest Amir, he'll be graduating high school, in 2018, and I want to see it. What I'm saying, I want to see it bad. So I want to see it. When I was diagnosed in 2010, I didn't think that I would. Mm-mm. And my doctors didn't either. They say that to me when I come in now, because I have when your doctor come in with your folder, my oncology doctor have a folder thick as that, what I'm saying? And I mean, that's very thick for someone, what I'm saying, because I have so many records from so many tests, from so many issues with the neurology issues, from the pseudotumor, with the Addison disease issues, with, what I'm saying, just the plain cancer issues and being BRCA. You know, it's a lot for us, what I'm saying, to go through. So, part of me doing this diary won't be always to educate and for something for you to grab a notebook and write down. It's gonna also be just a cleansing of a cleansing, and as I talk, hopefully some of you guys feel like I'm talking for you. You know what I'm saying? I'm saying the same thing you feel, because I'll also be the first one to tell you that our family, whereas they are awesome caregivers when we have them, those of us that have them, what I'm saying, and we appreciate them so much. Caregivers, I salute you for dealing with us. I do salute you for dealing with us. But at the same time, don't nobody understand this fight like another fighter do. Don't nobody understand this journey like another fighter do. Don't nobody understand, the fear, the just the stuck and being afraid, the stuck, the feeling lost because your old life and what you used to do is so contrary. And now for me, so far behind me that I don't even remember a lot of it than what it is now. And nobody understand that but another warrior. And that's a warrior of any chronic illness, what I'm saying? Anything that, any kind, it doesn't matter. Gastroparesis, what I'm saying? Lupus, what I'm saying? My niece, what I'm saying, suffered from lupus as well. Sickle cell, it does not matter to me. Any chronic illness, AIDS, HIV, it does not have to be the popular pink cancer. What I'm saying? I kind of get sick of that too for us. And I was at one point just a pink cancer, and so we would get special attention. October, we get this great, awesome walk that everybody attend. But lupus get walks, sickle cell get walks. What I'm saying? Awareness has to be built across the board, because we're all in a position of fear. Our lives are day to day, month to month, year to year. When you see another year, when you have a birthday, or, your cancer anniversary is what I call it, which is the date of my diagnosis every year, July 28th, I have this big reflection where I'm like, wow, I can't believe it. I made it another year. You know what I'm saying? I can't believe it. One of these nights I'm going to figure out a way to pull up pictures and to show you pictures, what I'm saying. They're on my Facebook, so you guys can always join me there. And, those who aren't already there with me, it's Keisha Smith. That's KEISHA. And in parentheses is ChemoCoach. That's on Facebook. On Instagram, even though I put up a lot of silly stuff sometimes on that, because sometimes you gotta just not think about the battle, and I try to. And Instagram is where I try to do that at a little bit. But you'll also see, if you go down the pictures, you'll see, like when I was bald, you'll see the medication. Right now, even my hair, because of this chemo, it just comes out, when you just comb it, big long strands of it come out. So you just try hard not to have to comb it too much. Basically, the depression comes from the fact that everything that made me feel like a woman, in my former life, it's gone. My breasts are gone. I have no breasts. They didn't know they could put no implants in me. And a lot of people that get implants in me, a lot of my warriors, they end up getting botched up jobs. Sometimes we have to keep going back and keep, getting it adjusted and fixed and corrected and all of that. And so even when they get the boobs, there's a lot of pain in that. And you just don't feel your confident self that you used to feel. You don't feel like the pretty woman, because the battle wears on you. It wears on you physically as well. You age. You feel like some. Your hair is, delicate and brittle. Your weight, what I'm saying? It's so many different things that goes on to your body. Like, as far as I go, and a lot of the fighters I know, you go through menopause. So you don't have a cycle any longer. I haven't had a cycle since I was 32, and that brings on other issues sexually. You go through a type of pain with with sex, what I'm saying? And you go through so many different issues. Everything that made you feel like a woman, you feel is stripped from you, just for you to be able to live. And your family members, while they're there with you and they're watching you while you're in pain and while you're crying, and they're rubbing your back, or they taking you through the hospital, through emergency, or to the hospital to get admitted in, when the doctors say, well, you need to come on in now, and I got to admit you for a while because you need blood transfusions, or you need, I call it the yellow bag, where when you're dehydrated, they give you this bag with all these minerals and vitamins in it because you're so dehydrated out, whereas they see the process, or they're watching the nurses put the port, stick the needle through the port. They don't feel the pain. And every time you do this, it just chips away a little bit more at your womanhood. And everything that, like, I look at pictures of me before sometimes, and I would wear low cut blouses. I was in my 20s, and I didn't have a care for the world. I wasn't thinking, cancer wasn't on my radar at all, y'all. I didn't even think about cancer. And I got, I'm genetically connected through my father's side. And I make it no secret that I didn't really know my father's side very well. So, and let's be honest, we just now getting open with social media. When people used to pass away from cancers in the past, or from illness, it would just be auntie died. Auntie wouldn't discuss it because it made you feel less like a woman. Or uncle died, no, he was sick. That's all people would say, is he was sick, because he didn't want people to know he had prostate or testicular cancer. That was a private thing, and that made him feel less like a man. Or that was a private thing, and it made her feel less like a woman, that it felt like we would be looked upon differently. But it's a new time now, and we're getting younger and younger and younger diagnosed. And I have fighters that I talk to every night that are 21, 22. I was 32, and I feel like that was young, Lord knows. And now I got girls that I got to worry about. I got daughters that I got to worry about if I pass this gene on to them. I have a daughter 25, and I have a daughter 19. And whereas, if you think I talk to you guys, that I've talked to them. And I have boys too. I have to worry if I pass it over to them. But if you think I talk about it to you guys like crazy, imagine how I talk about it to my daughters. But on the inside of me, the fear that I feel that I may have passed something to them, and they may have to fight this battle, just kills me inside. It's literally on the inside. I feel a knife, going in my heart because of that. my cancer was 2 o'clock to my heart, by the way. So, educating them. And my 19-year-old has made clear that I don't want to get tested right now, Ma, because I just don't want to know. And I can't force her. I could take her to my appointments with me, trick her into feeling like I just need her at my doctor's appointment so my doctor can come in and can kind of talk to her too, and it's like all a trick to get her in. But I understand because she don't watched what I've been going through for the last 7 years. So in her mind, she like, I can't do this. That's Damon again. See, he's getting, a little sick, which isn't a good thing for me either. But, he keeps me together. So my immune system, I don't have to worry about as much because I have a partner and a mate and a family that, kind of makes sure that everything is okay around me to keep my immune system right. He's kind of OCD. Damon's kind of OCD. So, keeping everything neat and clean when he's not at work is a big deal for him. And Lord knows that, I appreciate an OCD mate, you know what I'm saying? Because to be quite frank with you, I'm not the best cleaner. I can clean, but he cleans better when he's not at work or he's not home. He does a better job than I do. So thank God for small miracles and, all of that. But back to just the process and the journey, the fear, you guys, everybody that's fighting, that's watching this, know that I understand the fear. Know that I understand the process. Know that I understand the journey. Know that I understand the PTSD. Know that I understand the depression. Right now, over the last couple months, I've been working from such a depressed state. Because you got to realize we dealing with all this, but we still got to deal with the everyday woes that regular people deal with. And when I say regular people, I just mean non-sick people, non-chronic ill people. We still got to pay our bills. We still go through, arguments and confrontations with family members. And, if you still, have to work co-workers, and we still got to worry about, the kids coming in late. And, when my son is out driving, just worried about him because he's 17. We still have to, bills. Life. You know what I'm saying? We still have all of those stresses too. You know what I'm saying? And if you're in a relationship, you have relationship, issues sometimes. And sometimes the battle is what bring on those issues, whether your mate will admit that or not, because, they may feel like a slimy guy or a slimy chick for saying, well, hey, this battle is really heavy on me too. You know what I'm saying? But sometimes it comes up and, all these issues just bog you down and just make that depression peek through even more. You know what I'm saying? And I would be remiss if I sat here and made you guys feel like, I don't go through the same things that some of you go through. Like, some of you I talk to, your mates left you through the journey. You know what I'm saying? How crummy is that? You know what I'm saying? But they wasn't for you. They wasn't for you. You know what I'm saying? Some of you that I know, your mates don't leave you, but, they cheat on you. And when I say they cheat on you, I believe that any mate can cheat. I wouldn't put it past any mate. But some of us that talk and, and inbox, your mate openly cheats. You know what I'm saying? Because he feel like, or she may feel like, you don't have options in life anymore. So you got to deal with my bullshit. I won't cuss a lot. I'm a cusser. You guys, let me tell you that. But I will try hard not to cuss a lot on this because I know some of you aren't. But to me, a good cuss word sometimes just make me feel, better. Like sometimes I gotta say shit or fuck this shit. And sometimes when I get really mad, I got on the inside say that bitch. That's just me. It relieves my stress a little bit sometimes. We all have different vices. You know what I'm saying? That's mine. But the fear and, all that. I'm not going to keep you guys much longer. We've been on here 34 minutes. I'm going to take it up to maybe 36. And then I'm going to, end this one for the night. But the fear and the depression. Keep coming in my inbox, you guys. If you want to come with specific questions, you know what I'm saying? come with the specific questions. Remember, you can always say to me, which not you can always say to me. If you don't say to me, Keisha, mention my name, then I will not mention your name, because everybody that I talk to know that, I keep it close to the chest. I'm very, I understand, people confiding in you, and I'm honored that you guys do confide in me. So I would never break that confidence. I don't even break it with Diamond. I don't even share it with Damon, the things that we discuss in the inboxes. Okay. That's for my fellas as well that I talk to, because it's a few guys that I talk to as well. But know that, I will. But if you got specific questions, ask specific questions like 1, 2, 3, 4. Put them down your row. I promise I'll answer them. Or like last night after I did the first vlog, I got inboxes where people were saying like, Keisha, talk about the depression. You know what I'm saying? Talk about, people don't seem to understand that we not the same people we used to be between the medicines and the treatments. Yeah, I may forget a birthday now. Yeah, I may say, yeah, I'm coming to your wedding, but pain might hit me 2 hours before and I won't be able to make it. It's not that I didn't want to make it out to your birthday party. It's not that I didn't want to be around you. I'm not closed up because I have an issue with anybody. I'm closed up because I don't want to be the topic when I come to your party. When I mean topic, I mean in a good way. Meaning like, I don't want you to have to hover around. Are you okay? How you feeling? Are you all right? I don't want to do that. You know what I'm saying? And so sometimes I can't make it. And that's what came in my inbox last night more than twice. So I wanted to hit on that. That it's not that we don't want to be apart. It's that we dealing with this, pain, and dealing with this chronic illness, whatever chronic illness it is. Again, mine's just so happened to be cancer. I just so happen to be a metaviver. But as I've learned and studied over the past 7 years of being diagnosed, I've learned that one chronic illness really and truly ain't different than the next. We all deal with medicines that they put us on that, may or may not help. We all deal with pain. We all deal with the fact that family don't quite get it a lot of times. We all deal with the same things, and most importantly, we deal with depression and being post-traumatic. After us, a lot of my fighters that get to hear the word remission, after some of them hear that word, you'd be surprised. A lot of people would think like, you're happy, you're elated, you're like, whoa, I'm cancer free. But what I've learned, I'll never get to say that, so I just say this from, experiencing it through some of my cancer fighters. What I'll say about that is a lot of them are confused and stuck. They don't know what to do next because they've been fighting, and so much of their life have been lost to the battle and fighting that they don't know what to do next. So I'm gonna end this here. We're at 38 minutes. I told you guys I can talk, but I wanted to talk about the pain, and I wanted, those that's not fighting that watch this, I wanted you guys to be more understanding to the fighter that and understand that, they may seem like they seclude themselves off, because I'm definitely an openly closed person. I mean, I could talk all day about cancer with you, but I will retreat and close off and not answer my phone for days sometimes. And I know that's not right, but that's why I tell everybody to just text me, and I'll shoot you a text back and say I'm okay. Everybody know that if I don't pop off on Facebook for a couple days, people come out looking for me, because they know that I'm going through something. But like I say, we still got all the same worries you got. We got bills, we got kids graduating, and kids going to school, and we got family issues. I got a granddaughter and a new granddaughter on the way. I have my mother, what I'm saying? I have this mate. I have to show him from time to time that I appreciate and care for him, what I'm saying? And it can't always be about me, but at the same time, I'm always aware of the fact that, I'm fighting because I'm always feeling some pain or another. So I ask for you guys just to be more patient with us. And on this webisode, I hope that Carlitha, which has been my best friend since, elementary school. I mean, I don't even know how long we've been best friends, but I'm 40, and I'm telling you, she been my girl since I've been about 7, 8, so that long. And I'm saying this to you, Carlitha, that I know that I don't see you that often, and we don't get together. And you guys, when I was having your treatment and going down getting them infusions where I would have to get wheeled out sometimes, besides Damon, it was Carlitha there with me. Carlitha at that time was videoing everything because she was the first person to tell me it's important that people see this journey. So Carlitha Davis Brown, I want to say to you, I'm sorry that I don't get to the house to see you as often, and I'm sure sorry that I don't see Kalia the way I want to. I couldn't make it to her graduation party because, I can't be around like certain times of the year. My immune system is even weaker because people get sicker at certain times of the year too. So when those seasons change, I have to really stay away from people. But Carlitha, I'm sorry, but know that in my heart, you are always there. I call you my always bestie. You know what I'm saying? Because I know, nowadays, and especially because I'm an activist, everybody say sis or bro, and how we namaste and all of that. And everybody love you, you know what I'm saying? I guess because you're sick. But Kalitha, I love you. And you're my always bestie. And I'm sorry that I've been neglectful to the relationship. I promise you, I say in my head, I gotta get better at this, and I intend on getting better at it. It's been 7 years, and you guys, I'm still not better at it because I deal with pain, I deal with depression, I deal with, these issues, and with all the medications I take, I'm not adding a depression medication to it, you guys. I understand when people decide they want to not fight any longer, just summon it up because of the pain, because of the stress, because of the issues, or just because, a lot of people feel like the chemo and stuff is what, is killing us, whereas it's helping us, it's killing us. So they decide that they want to go more natural routes. I'll tell you that I have not seen a late stage fighter, and I've seen quite a few of them. From my own personal experience, I have never seen a late stage fighter that has stopped doing the regimen the doctor give them, that went on a natural, completely natural, which I do natural, I do alkaline, I try to eat right, I'm moving into, vegetarian zone. I can't quite pronounce the word, but I'm a pescatarian or such now, whereas I only eat seafood or whatever. But I'm trying to get completely right, but I've never met a late stage fighter that left that treatment alone and went completely holistic or natural and survived. I've never met one. I do know quite a few that did it, but all the ones that I know that did it, their pancreas end up giving out on them, or their immune system end up breaking down so badly that they end up dying, and I mean rather fast, within like weeks of coming off their regimen. So that's what scares me enough to stay on the regimen, because I gotta be here. Okay, now I'm at 43 minutes of being on here with you guys, so I'm gonna go ahead and end it, and I'm gonna tell you that this is Keisha the Chemo Coach. Again, for those who don't know me, Facebook me at Keisha, Keisha Smith, in parentheses is Chemo Coach. If you send a friend request to me, just let me know. I'm following you. I've subscribed to your Keisha, the Chemo Coach Smith, YouTube. So everybody subscribe to that for me. If you're on Instagram, I'm Keisha313, but that's with 2 E's, Keesha 313. Twitter, that's my angle as well, or handle as well, whatever they call it. But talk to me wherever any one of those websites or any one of those social networking sites you want to talk to me. I'm on Snapchat, but I'm still learning it. It's Keisha313 with the 2 E's, like Twitter, like Instagram, but I'm still figuring that out. And to be quite honest with you, I really just do that with my Pootie, my grandbaby Pootie come over. Her name Krista, but I call her Pootie, and that's Yaya's baby. whenever she come over. Really, I get on that because she loved to see those little filter things and the little cat eyes and all that type of crap come up. So, but I'm going to learn that too, if that's going to network me through and get me to more fighters and get me to more warriors and get me to more caregivers and get me to more people that just want to be educated in case they have to fight. Because you don't have to take every medicine the doctor offered to you. You can offer him an ideal if you educate yourself. And that's the problem I'm in as well now. We'll talk about that maybe tomorrow night, okay? The doctors and the medications and them trying to force you on certain things and the insurance company taking things from you. Right now I'm in a battle myself. You know what I'm saying? And that gets depressing. So I'm going to end it right here, you guys. And I'm going to say I'll be back at you tomorrow night. Subscribe. Press that subscribe button, okay? And share. It don't cost you a thing. And share this information. Share my page with others. Come into my inbox like you've been doing, and I appreciate it. But come into my inboxes or my DMs. Ask questions that you want answered on here. Talk about it. You don't have to do it. You can talk about whatever. If you want to talk about sexual things, because I've been getting a lot of that sex conversation, sex while in the battle, sex while on medications, what it's doing to your body, whatever you want to talk about, pain and death, losing loved ones to it, going to the funerals when you battling too. So while you at the funeral, like when I went to one of my girls that I coached, Simone's, going to her funeral hit me in a certain way, just like Ebony's did, because they have all this pink on the caskets and stuff, and you can't help but to say to yourself, this is gonna be me one day. You know what I'm saying? It's gonna be me. So whatever you guys want to talk about, the fear, you know what I'm saying? Like I said, don't have to be about cancer. Chronic illness is chronic illness. Okay? Subscribe, share this, join me. Let's open this up wide open, y'all. Let's do it. All right? Take care. That's Keisha the ChemoCoach, and I'm out for the night. Took my medicines. I'm about to lay it down, you guys. See you tomorrow. Bye-bye.